Tonight, we're getting an in-depth look at the innovative strategies being used to tackle the deadly fentanyl crisis with our special program, The Next Generation, Breaking Fentanyl's Grip. Joining us now with a preview and what we've been seeing here in the islands is Dr. Kevin Coons, a physician on the Big Island who's been working on treating addiction for decades. Aloha and good morning, doctor. Thank you so much for stopping by with us.
Good morning, Sam.
The overdose epidemic, it's reached so many families. I think it'd be unusual if it hasn't reached your family or people you know at this point. Is it getting better or worse?
Well, unfortunately, Sam, it's getting worse, and not only that, it is changing. So at the Hawaii Island Fentanyl Task Force, we check locally, boots on the ground reports, as well as Department of Health, CDC reports, et cetera. And what we see is not just an increase of overdose deaths, but an increasing amount of fentanyl causing those deaths. So current studies show that 37% of the overdose deaths in the state of Hawaii involve fentanyl, either alone or with methamphetamine. So while methamphetamine is still the major overdose killer at 56% of all overdose deaths, the creeping of fentanyl is here. And this mimics the trail we've seen from the continent since about 2013. So as it comes westward to Hawaii, we want to stop this tsunami coming to our doors. And, you know, overdose death is a crude measure of health. The other problems this causes, the destruction of families, the social structure of our communities, the well-being of everyone, our children, is also at stake. Unfortunately, statistics don't change the heart. And statistics, they're nice, but they don't change anything. So we have to reach people through the heart, and the way to do that is to talk to each other. So as a community on the Big Island, we're fortunate. We're the Big Island, but we're in communication. We know each other, we respect each other, and so the word can pass, and the grieving that goes together and the losses, they help start changing the numbers.
Yeah, the numbers are staggering, and like you said, we're continuing to see those tick up. As far as the things that we're doing to combat fentanyl treatment, naloxone, policing, et cetera, are any of these working?
Well, they all work, but they're all necessary, but even together, they've been insufficient. So the police department, and I will call out the Hawaii Police Department, excellent job, saves really hundreds of lives by their interception and by their work. The judicial system, necessary but still insufficient. Treatment programs, necessary if they're funded, still insufficient. And even naloxone, which is probably the best weapon we have for the overdose death, is insufficient to stop this epidemic. So necessary but insufficient. We need to do something a little different. This course we're taking has to continue, but we have to add something else. We have to do more.
When you look at doing more, what should we as communities and a state be doing?
Well, I think with many groups, we're all looking forward to how the state will disperse the over $30 million sitting now in the bank that will be used for this opioid epidemic. Those are part of the pharmaceutical settlement funds, and they'll be going out to the community. Hopefully very soon there'll be a draft of where that will go. That's number one. Number two is we must activate our communities. We will never incarcerate our way out of the opioid epidemic. We will never bury our way out of it. We will never treat our way out of it. So we have to go to the level of awareness, education, and prevention. And that involves community. That cannot trickle down from government or some agency. It has to come up from the community. And so activating the community into task forces, which are happening not just on our island, but on Kauai, brings people together, and they see their common problem, and they can find a solution locally. So we're happy that we've been able to get naloxone from the state. We've distributed close now to 30,000 naloxone kits over the last 3.5 years. And we do that while we give opioid education. So getting folks in schools to talk about this, getting the Department of Education to realize this is a real threat to the youngsters as they grow. These are things that we can do as a community. We can't wait for someone else to do it for us.
Yeah, well said. Dr. Kevin Coons, thank you for all your work over decades of service helping to fight addiction, and thank you for sharing these tips with us today.
Thanks, Sam. Have a good day.